Okay, guys, it is February 1st, around almost 5 p.m. I just got out of my OR rotation not that long ago. I got out at 3:30, which is actually the time I'm supposed to get out, but I've been getting out a little bit earlier. Today, however, though, we had a pretty good amount of ortho cases. It was a pretty busy day. I started out my day with a total knee, and then I had a partial knee. Then there was a patient who had a cyst on her left breast, and so they just pretty much opened it up and let it drain out. And then I ended my day, after going to lunch and everything, with a toe amputation. So the patient was a diabetic. They had neuropathy, which means, they really don't have any sensation in their foot or whatever area it may be. Usually it's lower limbs. And they probably had a small wound on their foot and it didn't heal all the way, so it turned into an infection, and then it was just a foot ulceration. So the doctor had cleaned it out earlier in the week, and I don't know why he didn't amputate it then, but anyway, the patient was back today and they amputated the toe. It was just an outpatient procedure, so they were able to go home after they got done with recovery and everything. So he would be going home today. And that was pretty much my day. That's what I did today. But it's getting better. I'm hopefully by the end goal of this would be me running the OR myself as a circulator. I follow a circulating nurse around, so she, preps the room for anything that they would need or helps prep it. Then there's the scrub nurse who actually handles the tools and things that she'll hand to the surgeon. And then whoever he has with him, it may be a physician assistant. There's the anesthesiologist or nurse anesthetist. And sometimes there may be more than one scrub nurse or scrub tech. And then the circulator, so they prep the patient before, like if they're having a total knee, they'll need to prep the knee and the whole leg to make it sterile with a sterile cleanse. And they will have to be gowned up in a sterile gown and sterile gloves, which I've been learning to do, or I already knew how to do, but I've been really getting into practice with it. Then we also start plugging up equipment like the Bovie, the irrigation system, anything, getting the patient ready once they're in the OR. And then once we're done with that, we go to the chart over there on the system, and we start charting everything, like what kind of irrigation they've used, what kind of position the patient's in, what kind of Bovie they're using, what kind of setting is it on, everything, what kind of medication we gave, what kind of orders, anything that we got out during the procedure or the scrub personnel got out, we'll charge for that, or we won't charge for it, but we'll put it on a pick list, and that will be charged, and everything. So it was a pretty full day. I mean, 8.5 hours, which isn't that long. It's not like a normal 12-hour shift, but I'm at a smaller hospital, so I'm not going to be doing 12-hour shifts in an OR because there's just not that kind of a need for it. So that was my day there. Right now I am finishing up my journal for these past few days in my OR rotation. Then I will be studying for my ATI predictor test that will be happening tomorrow. And I'm probably going to try to study for management a little bit tonight as well, but definitely start studying for management tomorrow. And then I'll have a quiz tomorrow. So just a little bit of fun stuff happening. This week is a tad bit busier than my normal weeks because I have an exam on Monday and then a test tomorrow. But I'll always have a quiz every single week in at least one class, if not two. So it's a little bit busier because I'm studying and working and going to these clinicals. But it's keeps me on my toes, and I have 99 days until graduation. So just waiting to get through to that. So tomorrow is my ATI predictor test. It is a big test. Tomorrow is just the practice though, and it doesn't really count for anything. But then we're going to be taking another one in a month or so that will be big time. Like, you have to pass this test before you can graduate. If you don't pass it, you can do remediation with an online coach, and then they'll give you the green light. Once they give you the green light, you'll be able to pass. like graduate, that is. But you pretty much have to take this before you can graduate, thus before you can take the NCLEX. So it's a pretty big test. But tomorrow is just the practice. So I will show you that tomorrow. Well, I won't show you the test, but I'll bring you along for tomorrow's day. And technically, my classes will be done tomorrow, but then I'm also going to bring you along for my Saturday and Sunday work. So that'll be fun. So today is Friday, February 2nd. I had a big predictor test for ATI in one of my classes today. And it was 180 questions. And it was really hard. And just a lot of questions. And I'm so exhausted, so I didn't do a video today. But after class, me and my friend went to Applebee's to get their $1 Bahama Mamas and some food because we deserve it. I'm back home now. It's about 8:45 p.m. and I'm going to do a little bit of studying for my management exam on Monday. And then I have to get to bed soon because I have a 12-hour shift tomorrow on Saturday. So I will show you guys a little bit of that tomorrow, what I can show you, that is.
Hey guys, so I was super tired today and didn't really have a lot of time to vlog while I was at work today, but I came home and I took a shower and I was super gross and I didn't feel like making a sit-down serious video, so you get me in a Snapchat filter for this little part of my Saturday. So it's Saturday, February 3rd. I worked a 12-hour shift, and I go back tomorrow on the 4th to work an 8-hour shift. And then I'm going to come home and study some more, and I'm going to study tonight, and get ready for my test on Monday. So I will see you then.
Just finished a long 3.5 hours in the ED, watching patients, so now I'm heading back upstairs to go home. So I had an actual video recorded explaining my day today, and my face was very much cut off because I forgot to do it in landscape mode. So I'm doing a quick little voiceover to explain that to you now, and then I just took the audio from my video and put some pictures of some NCLEX questions and the explanations to those questions over the voiceover. So that's why you're just hearing my voice with a bunch of random NCLEX stuff, but it's still explaining my day today. Hey guys, it is Sunday, February 4th. I didn't really do a video yesterday because, as I explained in the Snapchat, that I was just so tired and I didn't really have time to sit down and do a video. But after that 12-hour shift, and then today I was at the hospital for 8 hours. I came in expecting to work on the ortho floor, and I got floated, but not really floated. I had to go sit and watch patients. When you're a sitter, you go and watch potentially suicidal patients. So all you do is either sit in their room or you sit outside their hallway if you're watching multiple patients, and you chart on them either every 15 minutes or every 30 minutes, just their behavior, if they've had any suicidal ideations or anything like that, and just kind of like what they're doing or what they're saying. And then I went back to my floor, or I was relieved of my duties and thought I was going to go back to my floor, but instead I got but sent down to the emergency department. So I went to go eat lunch first, and then I went to the emergency department around noon. Around noon. And I sat outside 3 patients' rooms and watched them till 3:30. And it started to get really crazy down there because it was getting so busy with everyone coming in. But I finally left, and then I headed back upstairs to my floor to get my things, and now I'm in my car waiting to go home. When I get home, I'm going to be taking a quiz, doing a ticket to class, and studying for management because I have my first big exam tomorrow. So that is my Sunday, and that is the end of my week in the life of a nursing student. So it's been crazy busy, and I hope this kind of gives you an idea of what a week in the life of a senior nursing student is. A senior nursing student in their last semester, that is. So that's it for today. Thank you all so much for watching. I hope you enjoyed this glimpse at a week in the life of a senior nursing student. It can be very, very busy, but in the end, it's really beneficial because you're learning so many new things. So if you want to see more, please like and subscribe.